Thank you, Mr. Bean. Are there any members who wish to be recognized for further discussion on the amendment in the nature of a substitute?
Thank you.
Mr. Scott, you're recognized for 5 minutes.
Thank you, Madam Chair. I move to strike the last word, and I want to thank the Chair for her work on this bill. This bill improves the hospital billing in the commercial market by prohibiting hospitals from billing consumers of private health plans unless they comply with certain requirements. We know that the hospital industry accounts for 31% of overall health spending in the U.S. and is the largest single contributor to our national health expenditures. By addressing unfair billing practices, the legislation will help hold down healthcare costs for consumers. Specifically, the bill ensures that healthcare providers will be transparent with bill plans and consumers by providing sufficient information to accurately determine the setting in which the care is provided. This is particularly important as across the country, hospitals are acquiring independent physician offices and converting them to hospital outpatient departments, HOPDs. HOPDs are able to charge a facility fee and receive a higher reimbursement than freestanding physician's office or other lower cost settings, even when the care provided may be essentially identical. And while it may be appropriate and necessary for care provided in certain settings to receive higher reimbursement based on a variety of factors, this is not true across the board. In some instances, once a hospital acquires a physician's office, as the gentleman from Florida has suggested, the only thing that changes is the sign on the door. This does not justify an increased cost to the plan or consumer. This bill will ensure that providers are transparent about the location of the services provided when they submit a bill to a health plan. This legislation, along with recent actions announced by the Biden administration to crack down on unfair facility fees, presents a meaningful opportunity to ensure that the system isn't being gamed in a way that increases costs for workers. There's been demonstrated bipartisan and bicameral interest in this issue, and I'm glad that the committee has also prioritized moving these efforts forward. Thank you again, Madam Chair, and urge my colleagues to support the amendment and the underlying bill and yield back the balance of my time.